Good afternoon, everyone. We'll get started in about 3 minutes. Good afternoon, everyone. We're ready to get started. Folks are joining in. Thank you for dialing in today. We're very excited to be hosting Sarah diFransesca in a webinar around promotional activities in the era of social distancing. I'm very sure with this COVID crisis, everyone in compliance is thinking about how to manage, how to control, and how to really make these activities more compliant. So we'll have a very interesting and interactive discussion today, and very happy for you to join us this morning. If you can go to the next slides here. So just quick introductions. I'm Mohammed Awais, founder and CEO of Core Data. We provide compliance solutions to 30+ pharma and device companies. And I'm joined today by Sarah diFransesca. She's a partner at Dinsmall & Scholl. And just giving a background of Sarah, she has advised more than 300 pharma, biotech, and device companies in her career. And she just moved prior to the COVID crisis from New York to Cincinnati. So she's enjoying a little bit more laid back lifestyle, but very happy to have her, the level of experience she brings in advising those companies. So welcome, Sarah, to the conversation today.
Thank you for having me.
All right, next slide. So just quickly, I don't know why my name got changed or swapped, but I'm Mohammed Awais, and founder and CEO at Core Data. And over the last 4 years, I've been busy building compliance analytics and compliance technology solutions for pharma and device companies. Core Data provides the following. If we can go to the next slide here. Just by way of introduction, Core Data works with compliance operations team, and we provide solutions around transparency and sunshine reporting, analytical monitoring for data, and then also operational compliance, so live monitoring and digitization of workflows, capturing monitoring plan, and of course, creating checklists even for remote monitoring considerations. Next slide, Sarah. Just covering quickly the housekeeping items. This will be an hour-long webinar. If you have any questions, we would love for you to post them in the Q&A section through the GoToWebinar. We can address them as we go through or take them towards the end. Again, just a legal disclaimer, the views and opinions expressed by the speakers are our own. They do not reflect the policy or position of the company's core data and Dinsmore. We will record this webinar and we will make it available post-webinar for you to have a copy also of the presentation. Your lines will stay muted, and of course, all material is copyrighted. And if you do run into any issues and need to call, here's a number that you can take note of and dial in to get help. But what we would expect is as we go through, we would like to get your questions through the chat box. And as we go through this presentation, we'll also conduct short surveys to understand where you are coming from as an attendee, to be able to drive the conversations in those directions. So with that, I'll hand it over to Sarah to cover the agenda.
Great. Thank you, Mohammed. And thank you, everyone, for joining. I think there's a lot of excitement around this particular topic because it is no secret that we are all in unprecedented times and trying to figure out the best path forward for each of our companies. And that's further complicated by situations at the local, state, federal, and even global levels that are changing rapidly. So it's really tough to picture, I think, what that new normal will look like as things progress forward. And frankly, much of it is out of our control. So I think a lot of people are trying to figure out what is important to focus on right now, focusing on those things that we are able to control. And that would include ensuring that your company's compliance program continues to adapt to meet the evolving challenges in areas of risk that we are seeing. This, of course, requires rethinking or refocusing your approach to risk and to compliance to address the current situation. So in this webinar, we're going to discuss some of the ways that life sciences companies are adapting their promotional activities to the current situation and envisioning a path forward as the country starts to reopen. So we will include discussions on the various interactions with healthcare professionals that are governed by company policies and procedures, as well as industry codes like the pharma code that, frankly, were not designed for virtual interactions. We're also going to discuss compliance activities in a remote environment. So Mohammed, if you want to do the first polling question.
Yes, let's start with that. So audience, we would like to get where you are today. So what types of promotional interactions or communications with HCPs has your company adopted in response to the pandemic? I'm launching the poll. It should appear on your screens, and I'll give you about 30 to 45 seconds to make your entries. This question is multiple choice, so you can select more than one. And I'll publish the results here in a few seconds. It looks like almost half the folks have already voted, but there is still votes coming in, so I'll give maybe an opportunity for folks to see. And of course, this would indicate, as part of this response, where our company is going and what compliance needs to do to help that movement. Maybe another 10 seconds if everyone can kind of vote what they're looking, if they have opinions, put that in. Looks like we're close to 70% now. Okay, I'll close out the poll so we can look at the results. Sarah, I'm not sure if you're going to see that on your screen, but let me share it anyway. Do you see it on your screen?
Yeah, I can see it in the audience view.
Okay. All right. So it looks like video conferences and emails are predominantly the choice in this case, and then of course virtual speaker programs.
Yeah, it looks like a good number are doing virtual speaker programs, and then some other and some none. So not surprising, companies have tried to use the teleconferences and video conferences and virtual speaker programs. Emails are common. So those are all easy things that companies were able to ramp up very quickly. So those are not surprising results at all.
Okay, I've hidden the results. You should be able to get back to the slide deck. Do you want me to?
The slide deck's up. I don't know why it's not going back to.
Yeah, that's surprising because I'm seeing that poll on your screen, which is quite surprising. Let me see if I can, maybe I can, Ravish, if we can maybe perhaps change presenter for a second. I'll make myself presenter and then I'll change it to you again. So I just switched. Now I'm coming back to you, Sarah. See if we can. Let's see if you can present now. That was kind of strange, but.
Okay, so we have another poll. Hopefully we can figure it out this time, but the second question is about which types of remote software you're using for virtual interactions, to the extent your organization is doing them.
Okay, I put it out there, and it looks like the options we had on the screen also included Microsoft Teams, but we only have a couple of options here. But I think if we can get some quick poll, I think it'll be useful. Looks like there's a lot of almost 50% folks have voted, so give maybe another 10 seconds or so. It looks like Zoom has gotten to be much more popular over the last 6 months, but I'm sure folks are using other mechanisms as well. All right, I'm closing the poll, sharing the results, see if you can see that.
Okay, so most people looks like are using something else. I know Viva and Microsoft Teams have been popular. So yeah, I mean, various platforms being used, that makes a lot of sense.
Okay, wonderful. I'm hiding the results. Let's see if we can, okay. Seems to be working this time.
Okay, great. So if we turn to talking about these remote healthcare professional interactions, as we all know, life sciences companies have been forced to re-envision these interactions with healthcare professionals now that traditional face-to-face meetings are extremely limited or not possible. The state shelter-in-place and social distancing orders closed healthcare professional offices and healthcare facilities, and facilities that have adopted limited access policies have really merged to significantly limit the access to healthcare professionals right now. And this, of course, is coupled with those canceled or postponed medical conferences and other industry events that typically foster healthcare interactions. So companies are wondering when these restrictions may be lifted, if at all. While we are starting to see doctors' offices reopen and hospitals resume certain elective surgeries in some states, the restrictions on access to these facilities continues to remain in place and really gives rise to the question whether we will ever see a return to the industry activities we saw before this pandemic began. Many believe, or starting to believe, that the sales model is potentially going to change for good, not go back to kind of pre-pandemic times. So regardless of where we end up when all of this is over, I think it's safe to say that there's still pretty significant pressure on sales teams to perform. And when you have that pressure partnered with limited access to healthcare professionals in order to perform their jobs, it really can create the perfect storm for high-risk conduct. So one way to continue those interactions with healthcare professionals has been this trend toward conducting virtual meetings and product details, whether using Zoom or GoToMeetings or Viva or any of the other ones out there. One key compliance thing to think about is the materials that are being used for these meetings. To the extent that materials are being used, they typically are the materials that were originally approved for use by the sales team when they were having those face-to-face interactions. And so it may be necessary to kind of review your policies and procedures related to your promotional review committee to ensure that the reviews are conducted as efficiently as possible and that we're really taking a fresh look at those pieces to ensure that they make sense to be used virtually. Companies are also thinking about, to the extent that we're developing kind of new pieces for right now, whether they are kind of co-approved for use if the access restrictions ease. So, when we have face-to-face interactions again, will those materials be available for use? Or whether we're really reviewing these pieces for the current, and so maybe they have like a shorter use duration or a flag on them that they're only for virtual meetings. We also have seen an increase in emailing, and texting healthcare professionals. We saw that in the poll. And this includes sending promotional materials to healthcare professionals or making those arrangements to schedule a Zoom call. So these give your sales and marketing teams critical touch points with healthcare professionals. And certainly there's potential value, right? We see companies emailing digital versions of reprints because the mailed journal that the doctor is used to receiving in his office, he can't get to right now. So, still having those touch points, providing the information that the healthcare needs is important. The challenge is that most companies have policies or procedures that prohibit homemade materials and require all of these communications or materials distributed outside of the company to be reviewed and approved through the company's promotional review process. So how does your company figure out how to deal with emails and text messages that your sales reps might be sending out in light of these policies? So, for example, you may develop template emails that have been approved for use by sales reps when they email healthcare professionals, or you may adopt guidelines that say, for example, if you're texting a doctor to schedule a virtual detail, it can only be logistical information. The text message cannot include any product information. So these are all different avenues to give your sales and marketing teams those critical touch points that they need, but by putting up the guardrails to ensure that it is a compliant interaction. We also know that healthcare professionals and patients are, I think like most of us, spending more time on social media in order to socialize, obtain information, and of course, to be entertained. So your sales personnel may be using this as an avenue to maintain those relationships with healthcare professionals or patients, particularly if your company does not have a strong policy around social media. So this may be an area for the compliance program to reevaluate also. Really one of those key emerging activities that the sales team have really relied on in evaluating whether you have those policies and procedures in place to keep the organization safe. I think the other area here is product sampling. This is an area where it has been a challenge for companies and healthcare professionals alike. We do see a reporting in the decline of product samples. This is likely tied to canceled or postponed medical appointments, those unnecessary or non-urgent meetings. And, with social distancing and shelter-in-place orders, patient sample deliveries have become increasingly difficult to handle logistically. So we see compliance personnel remaining involved in these discussions about the business activities to ensure that the risk management challenges are being considered and the appropriate compliance parameters are being put into place. Okay, So if we switch to virtual speaker programs, I think this is really a continuation of the last slide. Rather than a sales rep doing that virtual detail, this would be some sort of virtual speaker program by one of our trained speakers. So, just like those remote programs, virtual speaker programs have been a trend due to that limited access to healthcare professionals. And frankly, there are some potential benefits for your company on conducting these types of programs. You don't have space limits. You don't have healthcare professional like time and travel expenses. They can be provided live. They can be pre-recorded, so you don't have any technical issues. And it also gives the companies a lot of flexibility to follow up on questions after the meeting, which again provides that additional touch point with the healthcare professionals that your sales team is really looking for. So we've seen companies able to generate fairly high levels of HCP interest and engagement on virtual speaker programs, particularly when they use these high caliber national healthcare professionals as speakers that they normally would not get a chance to hear speak. We've also seen a big trend on experimenting with different program formats in addition to kind of this traditional lecture style. Also things like moderated interviews and product demonstrations have become popular. We also see companies testing programs at different days of the week and times of the day to accommodate different healthcare professional interests and schedules. And this, again, is something that provides more flexibility than we would have with traditional in-person events. And then after the program, companies are repurposing the content, putting it on their websites, on their YouTube channels, doing podcasts or e-blasts to the material. So again, another touch point with those healthcare professionals. But all of these create areas of potential risk that compliance should be thinking through. Many companies have procedures for determining educational need relevant to the number of speaker programs that it will conduct each year. So, it's important to really evaluate how many programs is your company doing, these virtual programs, and has that educational need number change now that we are conducting virtual programs versus in-person events. If we're having very successful virtual programs, maybe we don't need as many. Or if we are conducting more programs because they're smaller and we're doing them at different times of the day, that also, potentially could be justifiable. But I think the process of going through that, doing the analysis and evaluating it is what's important. Another big issue is how do we ensure that healthcare professionals are actually showing up and participating in the virtual programs? And that's really to justify the number of programs that were being conducted, but also the compensation that's being paid to the speakers. Traditionally, at a traditional speaker program, we've done sign-in sheets. That may not be the most effective tool for a virtual program. So how is your company making sure that that educational need is being met? We're also seeing quite a few companies reevaluate their speaker decks to ensure that they translate well to a virtual program rather than an in-person program, which is probably what they are approved for anyway. One thing that we are seeing is the use of a shorter speaker deck. Healthcare professionals in particular, may be busy with things going on. And so a shorter deck may facilitate those meetings, but it's important to review the deck to ensure that the attendees are still receiving a presentation that is fair, balanced, and not misleading in any respect. So what is the material that we're cutting out is making sure it's not going to have a material impact to the rest of the speaker deck. And then the other area that I think is right for compliance is the Q&A session of a speaker program. You likely have a policy in place regarding how to handle like an off-label question that comes up during a presentation, and looking to see, does that same policy translate well to a virtual program? So for example, if your policy says that a speaker can follow up with a healthcare professional who asked the question after the program and address it in a one-on-one conversation, how do you handle that in a speaker presentation? And does the speaker call up the attendee after the program? Are we now going to refer those questions to medical affairs to address? So I think it's just, reviewing those options, thinking through them to help your organization address the potential risk areas that are emerging in these activities.
Sarah, we have one question before we get to the poll. The question basically says, can you comment on provision of meals with speaker programs?
We are going to get to meals very shortly. It is by far the hottest topic of discussion and next on our list. So we'll hold that for 1 second. Let's do the polling question first, and we'll see if maybe everyone can weigh in on what they're doing. It might help with the question.
Okay, so this should be an interesting one. What type of meals is your company providing to HCPs currently? And you should receive the poll on your screens. Again, this is multiple choice, delivering meals to offices or hospitals, sending meals to physicians' homes, providing meals to HCPs in some other way, or you've completely essentially banned the use of meals for any of these programs. So if everyone can vote quickly, we'd love to get opinions from everyone in the audience. That way, at least we'll have a better sense for how the industry is reacting. Looks like about half the folks have already voted. I'll give maybe another 10-15 seconds. This is, again, one of those conversations that is happening in every company, and hopefully we'll get some insights from Sarah on how they perceive this. Okay, I think we have enough responses, so I'll close out the poll and showcase the results. So we have about 70% still continuing to deliver meals to physician offices or hospitals. We have a few that are looking to send meals to physicians' homes, and then some, I think, quarter of the folks that are saying they're not providing to HCPs at this time.
Yeah, well, I think that is pretty spot on with what we are seeing across the industry. And I think, initially there was some interest in sending meals to the offices or hospitals, continuing to do that, especially during a really difficult time. But some hospitals in particular were not super interested in receiving them just for safety reasons. We also saw quite a few companies say, no, not right now, but those companies now seem to be going back and reevaluating what they want to do, given the length of time that things may be closed up. So, as I said, this is by far the hottest area of discussion. I think the challenge has been, how do we interpret the pharma code and the other guidance that we have in the industry to apply to this remote situation. So if you think about the pharma code, just as an example, it says that meals have to be conducted in office or an in-hospital setting, which is not feasible right now in most instances. It also prohibits spouses and other guests to participate in the meal, and it doesn't allow takeout meals or meals eaten without a company representative present, which of course is the exact situation that we're in. So how do these restrictions apply? And, thinking through and applying the spirit and intent of the pharma code to your current activities. So, we have seen quite a bit of variation here. We have seen companies, which is reflected in the poll, continuing to deliver meals to HCP offices, even if the HCP is not actively seeing patients. We do see delivery, or we have seen delivery of meals to hospitals to support that pandemic-related work. A lot of companies are evaluating whether meals can be sent to HCPs' homes if they're working from home, such as doing like telemedicine or a similar activity, or even considering delivering meals to their homes in connection with a virtual detail or a speaker program. And, I think those are being considered, but have been adopted less across the organization. It'll be interesting to see, again, whether there's a greater shift to those types of things the longer the shutdown continues in certain states, or it takes longer to get things up and running. Regardless of which way your company goes, I think there's a host of compliance considerations for each of these activities. So one is your policy or procedure, just for example, has a limit of $50 for lunch and $125 for dinner. And this may have been, when we were doing traditional meals and programs with doctors. So in order to interpret the pharma code requirement that we provide occasional modest meals, it's important to think through, do these same limits apply to meals delivered to a healthcare professional, either in the office or at their home? And, it's also things like, does it include the delivery fees and the tips for having this food delivered? So, in general, we have seen companies say, no, those types of meal limits are far too high for the current situation, and they are adopting substantially lower meal limits in order to reduce the risk of any meal activities that they are doing. Another consideration is how do we ensure that only the appropriate healthcare professional receives the meal and that we aren't feeding the entire family? So this has arisen, on easy delivery items like pizza. So the question is, can we deliver a large pizza to a healthcare professional? I don't know about you guys, but I know some people like my brothers who can eat an entire large pizza themselves. But, this isn't the case for a lot of people. So, is it okay to send a large pizza? Can we send a pizza and breadsticks or another appetizer? So, where does the line get drawn? And I think there probably is not a right or wrong answer here, but the key is really having these discussions so that the business is comfortable with where the line is being drawn, whatever it might be. Another one that's coming up quite frequently is alcohol. So your policy may something like, no more than 2 alcoholic beverages at a speaker program. So does this apply if you're delivering a meal to a healthcare professional's office or home for a virtual speaker program? And then it's further complicated because, some states you can deliver alcohol, some states or localities you may not be able to. So I think right now, most companies, at least that I'm seeing, are choosing to not allow alcohol to be delivered, just have decided that it's not worth any associated risk. But that's another one, it's just what types of things are coming up in your company and what are the compliance parameters that we need to adopt right now. Another place companies are dealing with how to address the intent of the pharma code as it relates to the requirement that meals be provided in conjunction with an informational presentation or detail. Previously these meetings occurred often during like a breakfast or a lunch or other non-patient time. And now, since there are these virtual details and healthcare professionals have different schedules, they may occur more randomly or not necessarily at a meal time. So I think this leaves compliance struggling to find ways to verify that a legitimate meeting or presentation occurred if a meal is being provided. Some companies are still say, like, if you're having a virtual detail, you still record it in the same manner as you did in the past for an in-person event. Others have adopted procedures like taking a screenshot of the program attendees to document the meeting. And so, again, there's probably no one right way to do this. It's really thinking about what works best for our organization so that we can demonstrate that compliance. The other piece to think through is that the intent of the pharma code is really to ensure that meals are not used as kickbacks. So we know from settlements like Salix and Novartis and Forest that meals can be viewed by the DOJ as a kickback when used inappropriately. So, I think companies are really struggling with how do we ensure that any communications related to meals are not being used as an inducement. So we're not inducing those healthcare professionals to order a meal in order to secure that virtual detail or to secure a speaker program registration. And one way that we're seeing that seems to be working well from a compliance perspective is to avoid including any information about meals in the invitation or the initial communications to schedule a virtual detail or a speaker program. And then only after the doctor has registered for the program or scheduled that detail visit, the follow-up like logistical emails about how to dial into the webinar and that type of thing would contain information about ordering those meals. And so that way, it's completely separate or independent of the actual getting the healthcare professional to the meeting. Meal ordering logistics have raised some compliance questions. So how do you get a meal to the doctor's home if that's what your company is doing? So some companies are allowing sales reps to order the food for delivery to the healthcare professional's home and to submit receipts through kind of the typical expense reimbursement process. Other companies are saying, no, that really doesn't make sense for the current environment. And so they are allowing healthcare professionals to place the order and then submit the receipt for reimbursement directly to the company. And regardless of which way you go, I think each of these scenarios requires kind of new procedures for reviewing and approving, doing the reimbursement, as well as tracking and reporting those expenses to meet transparency requirements. So I think it's critical here that sales reps and others who may be coordinating meals for healthcare professionals understand that even if your company permits those meals, there are state laws and institutional policies that may prohibit it. So, really emphasizing that all applicable laws and policies have to be followed for compliance.
Sarah, quick question here. We were working with a customer, and one of the things they've adopted is they're allowing meals to be served for these virtual events only in states where there is lockdown in effect. So as soon as cities or states where things start to open up, they're completely disallowing any sort of meals for virtual events. I don't know if you're seeing something similar where this kind of, at least to me, it looked like very binary, even in areas where I feel, once we start to see some semblance of activity return and we're out of this, mandatory, lockdown periods. Well, I don't know how long it'll be for New York and New Jersey, but at least the rest of the country where we are seeing some semblance of opening up, isn't there going to be sort of this phase where there'll be very limited interactions anyway, right? Even if the state mandates things to open up, the level of activity that the sales reps will be able to conduct will be quite limited, and there may be some sort of phase where virtual activities will continue in conjunction with in-person or physical for at least a period of time, if not, forever.
Yeah, I think that's absolutely right. Even when the states begin to open, allow things to occur, it doesn't mean that sales reps are going to be able to walk through the door. Because I think, for example, here in Ohio, we are, for a large part, open. Doctors' offices are open. The elective surgeries have resumed to a certain extent, but sales reps are still not allowed to walk through the door at most of those offices or facilities. And I think the one area that is going to be really interesting to see how it plays out, but I think we're, probably in lockdown for quite a while, is the skilled nursing facilities and the nursing homes. They're not even letting family members in the door, in a lot of states, let alone sales reps and other third parties who may potentially expose those individuals. So I think we're going to be in this phase of adopting and continuing to evaluate this situation and making changes and just trying to figure out the best way forward for a while. And it may not be the same in every state. We might have to adopt different policies around different areas, but it's just something that is going to have to continue to evolve, and the organization, the compliance program, is going to have to be flexible enough to respond in a timely manner.
Makes sense. And I was kind of just wondering about, this binary aspect of, allowing it for a certain period. And, just because, as we saw in your earlier slide, the pharma code is very explicit that it can only be done in in-person type scenarios. And so at least for this chief compliance officer, it was critical to maintain, compliance with the code once the sales team could actually engage.
Yeah. I think once sales teams can actually engage, we may shift and see that kind of shift, that binary approach to it. But until that kind of happens, I think we're all just kind of in a holding pattern, and are going to have to wait to see how it plays out. But I think that's a possibility.
Okay, thank you for addressing that.
Okay, so I think we have another polling question here.
Okay, I'll launch that. So there is context to this this question specifically, because I know, at least working with life sciences companies, we found sign-in sheets to always be an area that is either manual or a challenge to manage, and of course there's a lot of compliance considerations around it. So we wanted to just capture how folks are actually what stage they are currently. Are they using paper-based sign-in sheets or digital sign-in sheets? But then now working through this process of virtualizing these programs, are you looking to move from paper to digital or something else? Because as we talked about, having those meals served to physician homes or physician themselves ordering, what would be the process that allows compliance to get that on the record, that physician was present, or at least had that meal, not only for transparency and purposes, but also to prevent any non-compliant activities. And then also to have that sort of record for any disputes that might come in post the reporting cycle. So if you could, if everyone can take maybe another 10 seconds or so and just provide your input, that would be very, very valuable as we look at what might be some of the solutions that could work in conjunction with, for example, Zoom or GoToMeeting or Viva or some of the other platforms in this as we stay there. Looks like we have close to half the folks have voted, so I think that's enough time. So I'll close out and kind of look at the polls here. And it looks like most folks are still using paper-based sign-in sheets, and some have moved towards digital, and then there is still a quarter that's looking to move from paper to digital, and about a tenth of the folks are doing something else. And if you're doing something, if you voted for other in this question or the question around what virtual meeting platform you're using, it'll be really valuable if you can provide in the chat window what's the other mechanism you're using, whether it's for that remote meeting or for the time sheet. I mean the sign-in sheet. It'll be really valuable for us. So I'm going to hide the results and give it back to you, Sarah.
Okay. Ooh, we did it that time. Okay. So as we kind of wrap up with meals and move to another area, gifts and donations is another area that we have seen some compliance reviews occur. So, I think life sciences companies understand the challenges that hospitals and providers are facing. It's certainly been unprecedented times in the healthcare industry, and life sciences companies are really looking for ways to be good business partners and really show compassion for the challenges that the healthcare professionals are facing. So we've seen gifts and donations take many forms. This has included, providing meals to healthcare professionals and first responders, donating PPE supplies, or making product donations, and other financial support to various relief efforts. I think the most critical thing here to keep in mind is that, it's always important for legal and compliance to be involved in these discussions about donations to make sure that compliance with anti-kickback laws and state gift ban laws are all considered. The DOJ has made it clear through various pronouncements that they have made that a key focus for them is going to be fraud related to the pandemic. So, it's really important to think through any relief efforts that you may be making, evaluating whether the company is kind of providing general support to a relief organization or other charitable organization, which may be less risky than something like providing support directly to a healthcare provider or facility. But, regardless of the donation type, I think it's critical for the company to document the intent of the donation contemporaneously so that if questions are asked in the future, you have that documentation of kind of where the company was and its thinking at this time. Another area, keep in mind is transparency. We have challenges potentially with addressing the processes that we're using to make sure that we capture these donations for reporting purposes if needed. But also remembering that if it is reported, it is something that the DOJ and competitors and others may see when it ultimately gets reported. So while the organization may have appropriate intent right now during the pandemic, just consider what the optics will be, next year when it gets put on a website for everyone to view. Will the situation be different or have a different light to it, in a year or 2 years from now? I'm sure that you and your teams have discovered that commercial is not the only part of the organization that has experienced a lot of transition during this time. A lot of companies are experiencing increased pressure and demand on their medical affairs organizations. This is partly because MSLs are also having limited access to healthcare professionals. We are seeing those canceled or postponed medical conferences. And then we're also seeing the added pressure of COVID-19 specific questions or issues. So this can take the form of access to medicines during the pandemic, supply chain concerns, off-label uses of product if there is a delayed or missed medication, and quite a few questions about immunosuppression and whether patients should continue to take certain drugs if they are facing a potential virus of this significance. So I think here legal and compliance can support the medical affairs organization by considering whether there are additional standard response letters or FAQs for those emerging questions. MSLs can implement virtual meetings in a manner similar to what the commercial organization is doing. And I think it's also a good time to look at your policies and procedures for those interactions between commercial and MSLs, how they document an unsolicited request for off-label information or for an MSL visit, and really making sure that we can continue to support compliant interactions between commercial and medical, even when everything is done completely virtually, including the subsequent interaction with the healthcare professionals. Okay, one final polling question.
Okay, all right, so this question is around what is the most challenging activity for compliance during this pandemic. So I'm going to be launching this poll again. This is multiple choice. You can pick more than one if you like. And the options are risk assessments, revising the policies, procedures, conducting internal investigations. I can imagine that could be challenging. Of course, monitoring over remote programs. I know of one customer of ours that are monitoring 100% of their remote program. So I don't know what type of percentage of policies others have put in place, and then of course training could be challenging. So if we can get folks to vote, maybe in the next 10 seconds or so, and then we'll get a good picture of what are some of the challenging pieces for compliance. I would imagine, at least at this point, because of the situation, the first maybe stab at this would be basically what is allowable, what is not, and then putting together the procedures and policies for those things that are going to be allowed, how they could be conducted, and what are the additional compliance protocols that need to be taken into consideration. So I'm going to close out the poll to get that review from the audience, and it looks like risk assessments and compliance monitoring and auditing feels like the most challenging parts, at least for the compliance teams online today.
Yeah, that's good. That makes a lot of sense. Risk assessment, certainly there is plenty of emerging business activities to be assessing. So that's great that companies are doing so much in the way of risk assessments. Compliance auditing and monitoring also, I think that makes a lot of sense to be spending resources on that right now. I'm a little surprised that the compliance policies and procedures is as low as it is, but we can talk about that. And compliance training. Okay, great. Well, let's flip to then. Okay, so let's talk for a few minutes about these remote compliance activities that compliance officers and their teams are facing right now. I think it is safe to say, or safe to assume, that we will need to be prepared for some sort of new normal, and striking the right balance between compliance and kind of effective business activities is where the compliance effort is being spent right now. I think it's really important for compliance to focus on minimizing the risk of new business activities to the extent possible. This definitely is not the time to become complacent, which admittedly is hard to do when we don't see our colleagues on a regular basis and we're all interacting virtually. I know a lot of people are just getting exhausted of Zoom. And so it's really important to fight through that and not become complacent. It's probably one of the situations that we're going to have to accept that everything may not be perfectly compliant right now, but we also can't use that as an excuse to abandon compliance, ethics, and integrity right now. So instead, the situation really, I think, presents an opportunity to reaffirm the company's commitment to ethics and values, and to emphasize a very strong compliance tone from management. And I don't just mean management tone at the top, but management at every level, and really to kind of empower that compliance message throughout the organization. I think in order to achieve that, compliance personnel are going to have to be proactive, which means designing and implementing program adjustments and remaining flexible to address kind of the emerging risks and operational challenges, which it looks like from the polling you guys are on top of. It's also being proactive by expanding your monitoring and oversight activities and focusing on these risk areas that are relevant to today. So, to the extent that we know more emails and text message communications with customers are occurring, maybe that's where we switch our monitoring activities to, as well as virtual speaker programs. I mean, dial into one and see how it's operating, whether there's any risk that could be minimized by tweaking the process. Like I said, the polling on the policies and procedures was a little lower than I expected. I think companies have found that there are tweaks that need to be made to business activities, things like healthcare professional meals. And so anytime that you find those tweaks to the policies and procedures, it's probably necessary to document them. And I know you're all like cringing because it's such a headache sometimes to revise policies and procedures, but I think it's critical for documenting that intent that we've talked about and demonstrating that the company really did understand and appreciate the risk and made policy decisions based on the spirit of the law, the spirit of the pharma code. And I think there's a variety of ways to do it. Some companies are amending policies and procedures just essentially permanently, whereas others are adopting some sort of temporary policy and procedure that they can then later rescind if we go back to normal activities. So either way works. If there's some other way that makes less of a headache for you and your team, go for it. I think regardless of how your company handles it, it's really about achieving that business need of documenting the process and the changes. It's also a great time to conduct compliance training and issue compliance reminders. So, employees may not be as busy right now. They may have time to focus on these types of items. But it also reinforces that the company expects compliance despite the impact that, the business has sustained by the pandemic. So, compliance should consider increasing the frequency of communications. Also think about interacting with employees in a variety of ways. It could be emails, but also, pick up the phone and call them, do online trainings, do group virtual meetings, kind of meet them where they're at right now. So, I think it's also important during these communications and these trainings to take the opportunity to emphasize to your employees the need to report compliance concerns. We have seen companies see a significant drop in the amount of information that's being reported to their compliance hotlines, which is partly to be expected because we have less activity going on, at least those in person. But there is still activity that is occurring, and if no one's reporting those compliance concerns, it may be something that is not as readily discoverable given the remote activities. And so it's really important to encourage employees to report that or to ask questions, let you know if there's something that is unclear to them. We've discussed it. Promotional review committees likely have been busy. They should be considered. They should be considering previously approved materials to make sure that they're working for the virtual activities. They also should be thinking about reviewing template emails or social media posts, other materials for the field to use to ensure that they comply with those company policies and procedures on homemade materials and making sure that everything kind of going outside of the organization is approved in advance. And then we get to internal investigations. And we all know that internal investigations are a critical element of an effective compliance program. They are something that tend to be challenging even under good circumstances. And so adding the remote element to them only makes them more challenging. But I really would encourage your organizations to ensure that investigations are conducted timely and thoroughly in accordance with government guidance on what constitutes an effective compliance program. And so, the challenge is, well, what is timely or what is thorough when we're talking about a remote internal investigation? I think the most important part is for compliance personnel to not use this time or the remote working environment as kind of a rationale for slowing down the investigations process. There are going to be limitations. Perhaps important documents or data that you need is on some employee's laptop or phone, or hard copy documents that you need are only in the office and you can't get there right now. But proceeding with the investigation, doing the best that you can under the circumstances and with the data that is available is almost always better than delaying an investigation that may continue to expose the company to legal risk. If you are conducting interviews, whenever possible, I would encourage video conferencing instead of a teleconference. Video conferencing, is kind of the best option we have right now in order to build rapport with a witness, to be able to observe kind of their credibility, which we would normally be able to observe in an in-person interview, and if needed, to utilize documents. But regardless of the method used for conducting the investigation, I think it's important to keep confidentiality and privacy issues front of mind. Maintain the same level of formality that you would use for an in-person interview, and if it is appropriate to give that upjohn warning. You also may want to consider confirming with the witness, getting affirmative confirmation that the conversation is not being recorded, that he or she is alone, some third party is not listening in. And then to the extent that your company is thinking about, should we record this interview for our own records, I would just caution you to carefully consider that. It does provide an opportunity for discovery by third parties at a later time. So just think carefully about that one. Okay. So with that, I think we have a few minutes, maybe one, for any questions. If there's anything else to wrap up.
No, very, very engaging conversation, Sarah. I do have a couple of questions. If there's additional questions, feel free to ask in the questions box. If we're not able to answer it right now, which is unlikely, we will certainly get back to you and have Sarah respond to those. So just a couple of, one question and one thought. The question was, in our virtual remote presentation software like Zoom, GoToMeeting, and others, we do have this chat function that can potentially be used for communication. Should compliance teams be considering implementing procedures and policies around that chat, similar to what they might do, for example, for an SMS or text communication with HCP? So that's a question. And then just a thought, do you see, or do you think that the sales model in most pharma and biotech firms will change or evolve because of this over time? And one thing I heard more recently was that the ratio of sales reps to MSL is going to change, where some of these interactions will become more scientific in nature. So I don't know if you can address both of those, and then we're going over time, but we'll certainly send everyone recording. If people have to drop off, that's understandable.
Yeah, so your first question about should we kind of have policies, procedures, guidance about chat features, the answer is absolutely yes. With regard to your question on the changing landscape of the sales model, I think it is going to change. How it's going to change, what it might look like, I have no idea. That's for people way smarter than me, but I definitely have heard a lot of rumblings about it, and just a lot of unclear direction on how, no one really has a clear vision of how this is going to end. And so trying to get to that new normal, I think, is creating a lot of angst about, is this model going to change? And the answer is probably yes. How? I don't know. But with that, I will say thank you to everyone who participated today. Mohammed, thank you again for hosting me. And if folks have any other questions, feel free to reach out. You certainly have our contact information. But again, thank you very much. And, go out there and continue strengthening those compliance programs.
Thank you, Sarah. I appreciate your guidance and the interesting conversations. Very engaging, and I'm sure the audience found value. Folks, if you do have any questions, suggestions, or any feedback, please let us know. At Core Data, we'll continue to host compliance professionals and legal experts throughout the next couple of months to have more of these conversations. So we look forward to seeing you there as well. Thank you for the ones that attended, and thank you, Sarah, for the presentation. Take care, everyone.